There are reports of the first adverse reactions to the vaccine in the U.S. after two other cases in the U.K. last week. A medical staffer at a hospital in Alaska had to be rushed to the emergency room after receiving the first dose of Pfizer vaccine. Now, Liza Lucas is at the 11 Alive Bridge with the very latest. Liza.
Good morning, Fran. Yes, that worker, as you mentioned, she had a serious side effect, a serious allergic reaction. And we actually learned that there were two cases of healthcare workers in Alaska having reactions overnight. This coming down from Bartlett Regional Hospital in Juneau, who reported that the two workers showed reactions about 10 minutes after getting the dose. The first worker showed signs of an anaphylactic reaction with shortness of breath and rash. She was given a dose of epinephrine, but later needed another dose, and she's being kept in the hospital for observation. Now, unlike the UK cases, the first Alaska worker had no history of allergic reactions. That second healthcare worker, he suffered a less serious allergic reaction, and he's already been released from the hospital. The state's chief medical officer saying that they expected such side effects could occur given the British reports, and they were watching for them. Still, a word of caution from Dr. Anthony Fauci.
If you have a history of a severe allergic reaction, you should either not take this vaccine, or if you do take it in the context of a place where if you do develop an allergic reaction, it could be readily and effectively treated.
As Dr. Fauci mentioned, the CDC is recommending that people stick around for 15 minutes after getting that dose of the vaccine just to make sure there are no side effects. And if there are, they can be treated very quickly. In the meantime, we should say that tens of thousands of medical workers have received the vaccine this week, the majority reporting no side effects. And the hospital in Alaska, they say that even though these workers had reactions, they're still encouraging their colleagues get the vaccine.
All right, Liza, thank you. And on